Hi, everybody. It's Dr. Linda from the Vascular Birthmarks Foundation. A little bit early, 2 minutes early here of our start time, but that's okay. We're live from Athens with Dr. Stavros Tombris, the medical director of the EVA Clinic, the European Vascular Anomalies Clinic in Athens, Greece. But before we start having people log in at 6 o'clock, I want to tell you about something new we have, which is it's a vascular birthmark. It's a little 5.5 by 8.5 card that we will make available to you for free. This card has all the different vascular birthmark types, and on the back, it explains that this is a vascular birthmark. It shows some pictures with purpura, so that if you're having treatment for a port wine stain, and a lot of parents have told us they've been stopped at airports, they've been stopped at the street, it says, don't worry, this is not contagious. There's nothing wrong with this. So you can bring this informational sheet on the back and then the pictures of the various birthmark types on the front. Also, we're having a free clinic tomorrow here in Athens, Greece. So we're not turning anyone away. I mean, we really can't see any more registrations at this point, but anybody who comes or messages us through our website, we will make sure that you at least get a clinic appointment. So in less than 1 minute, we will start taking questions. April's on. Hi, April. Good to see you. Thank you for joining us. April's our social media coordinator. And so at any moment, it looks like Sebastiani is on. So hi, Sebastiani. We will see you tomorrow. And we will be having a lecture series tomorrow with top expert physicians, correct? Friday. Tomorrow, everybody's checking in. Friday is the lecture series, and Saturday is the clinic and the free laser treatments. Okay, yes. I'm getting my days mixed up, everybody, because I flew last night to Greece and didn't sleep on the plane because I was watching movies. So I'm a little groggy, but you'll all forgive me. Oh, my phone is beeping. Okay, let me just turn that off so we don't get any beeps. Okay, so thank you for presenting. So anyways, we are now live and ready to receive your questions. So I see that we have 4 people on. And once again, Dr. Linda, hi, and Dr. Tombris, say hello.
Hello.
From Athens, Greece, and we are here to answer your questions on the diagnosis and treatment of vascular birthmarks or vascular anomalies or associated syndromes. We are having our VBF I-Team conference on Friday and Saturday here in Greece. Let me just see if there are any questions coming in. Sometimes it doesn't scroll up for me, but I'm not seeing any coming in yet. Okay, so that's good. So this is usually our quiet time before people start checking in. Oh, somebody else has just popped on. But once again, I'm talking about, we have this card available. It's a vascular birthmark as an informational card. We just finished our month of awareness, so thank you, everyone. Hello from the Virgin Islands, April. We just finished our month of awareness, and thank you to everyone who participated with over 101,000 people that we reached and over 34,000 that participated in our Put On Your Birthmark. And I know this is a little bit of a different time period, so that's why we put out a lot. Oh, let's see, it looks like, let me get over here. We might have, Chris. Hello, Dr. Linda and Dr. Tombris. My name is Christina. I live in Romania. I am 40. Thanks to these VBF live sessions, I became more confident and asked for a second online opinion from Boston Children's. They confirmed I have FAVA, which is very complex. You and I have talked about this. That is the fibro. I think it's a fibroadipose vascular anomaly. Mm-hmm. And they're very painful, as you know, Chris, but they are the leading treatment center in the world. My life is very limited. Dr. Spencer recommended a radical resection of the entire solaris muscle. She says that an orthopedist, oncologist, surgeon, familiar could do this. Is there a doctor in Europe who could perform this? How can I have access? What do you think about this?
What type of operation do you need?
Well, the doctor from Boston is saying a radical resection of the soleus muscle. So hers is, these are always lower extremity.
They need an orthopedic surgeon who is experienced with vascular anomalies. So when we deal with specialties required to be familiar with vascular lesions, we have to find a doctor who is really able to perform such surgeries. We may have excellent orthopedic surgeons, but we really need the specialized ones that are able to deal with these lesions. And as you know, the Fava syndrome is not like a common one, it's
Right.
a very rare one.
Right.
So you won't find a doctor who has done maybe hundreds of them. And we may be able to help you. We will find in our network in Europe someone who has really been confident in removing a vascular lesion from an extremity, and we will get back to you with some information soon.
Right. Well, Christina, I know actually our world-renowned expert, Dr. Robert Rosen, who's here tomorrow, he's done a few of these cases. He's out of New York, and he refers most to Boston. Yeah. And that shows you how few there are in the world that really do this. So I feel for you because you're one of the rarer of the rares. But please email me at drlinda@birthmark.org or vbfpresident@gmail.com. And I will desperately try to find for you. I'll reach out to ISFA and see if in the ISFA network, the International Society of Vascular Anomalies, if they have someone
That's
in
one
Europe.
Of the PIK3
PIK3
CA mutations. There
Yeah.
are many conditions associated with this mutation with different clinical outcomes. And basically, the surgical part needs to be, I mean, it's the same. It's just a surgery, it's a removal, but somebody has to be really confident in undertaking this kind of case.
Right.
So, as you already know, there are not many people trained to do so. That's why this is where the difficulty is, to be able to find and network doctors to be able to perform surgeries like that in the extremities, the face, the trunk, etc.
And I've been wanting to add someone, Christina, too, to our team that is familiar with this from Boston. So I'm going to try to see if we can get somebody involved that can start coming on some of our international trips. So Paula wants to know, can I ask you your preferred treatment for leg length discrepancies due to vascular birthmarks, which we see a lot with KTS?
Yes, there are some recommended treatments for this. But if you're talking about discrepancy, then you definitely need a consultation from, an orthopedic surgeon. And each case is so complicated that there is not a golden rule to be able to answer to you. The reason being there is soft tissue enlargement, there is bony discrepancy. So you really have to be seen by, again, an orthopedic surgeon who has done some of these. And there is no answer to your questions right now, but I'm sure there is help available to you if we find the right people to provide it to you.
And Paula asked a good question because they get so many differing opinions where some doctors say do it before puberty ends, you know, if you're going to do any of the shortening or shaving, and then others say wait until after they've fully grown. And I think that's the big discrepancy that we have. So we, even in our network, have doctors
It depends on the level of the
involved
disability. Like if we have an excessive amount of discrepancy, then we may have to do it earlier. If it's just something that it's not a major discrepancy, then we may be able to wait. But again, this is a decision of somebody who is familiar with treatment of KTS. And again, not many people are.
Right.
That's why VBF is trying to network doctors and train doctors to be able to help you
And she can email Dr. Rosen or Dr. Delphinian right
Exactly.
through our website at
Dr. Rosen
birthmark.org.
or the thing is that
Yep.
people to be able to consult you the best possible way.
So we want to say hi to Molly, Delia, Shelley. Hi, Shelley. McElroy, Bass, one of my long times. Corinne, who's a very big part of VBF. She's been with us for over 15 years. She says a hi to you, Dr. Tombris, and to me.
Hi to you also.
And so then we have Erin on and Mentors on. She's had side effects from treatment of hemangioma with PDL laser. Mentor, have side effects. So Mentor is coming to our conference, I believe.
Okay.
And he's an adult male. I believe it is a port wine, probably called a hemangioma.
Maybe or
but-
superficial hemangioma.
Yeah,
How old is the patient?
adult male.
Adult, not a
So-
hemangioma.
Right, so side effects. I think that, will have to be discussed when you see him probably tomorrow. And
Yeah, there are cases of side effects, and it's all dependent on the experience of the intervening doctor, the machine, the settings. Everything has to do with the outcome. So you have to realize that when we say, okay, we're going for laser, but who is doing the laser? What laser is he using? What are the settings of the laser? What is the experience of the doctor? These are all variables and reasons to have different outcomes on the same kind of cases. So we will be able to evaluate your case, and we will be happy to give you a solution of your condition.
well, and also, when we have an adult that mentions hemangioma, then we know
It's
that
not a
either,
hemangioma.
right,
It's
or that they had a hemangioma as an infant, they may have some residual tissue, or that it's a port wine stain because they're how often, like frequently misdiagnosed.
An adult technically should have a capillary malformation.
Correct. Hi, Sherry. Sherry, the VBF board chair, is on, joining us from Texas. Paula Tootie's on. She says, I live in Ireland, and the difference of opinions is great. It's amazing, isn't it, Paula? We know now that at Boston Children's Hospital, leading treatment center in the world, they report a 65% discrepancy in diagnosis amongst physicians. So imagine the ones that aren't as knowledgeable. Leanne Hubbard, she's shared on Kennedy's cause and in the LM family group. Thank you. Okay, thank you. Thank you for sharing on that. Dr. Tombris, you have a lot of familiarity with treating lymphatic malformations and
On the
ABMs
face.
on the face. Yep. So Treston Ashley is on. Best treatment for a port wine in half the face. We've been using a PDL and doing every 3 months. We also have some scarring and cannot find something to help. What should we be putting on it?
Well, basically, scarring is a result of treatment. I personally do not have faith in any gels or any auxiliary treatment modalities to be able to correct it. We have to see the problem, and we may be able to use a different laser to promote collagen production underneath in order to improve the scarring that you have. But without seeing a photo or without seeing the case, I'm not 100% sure if it's going to work as well. But technically, if we improve the amount and the structure of collagen underneath the scarring in general, we will be able to improve the appearance of the area. But this is with a different laser, not the PDL.
Right. So what would that laser be
It's
that
a
you use?
nervium YAG
Or
laser.
a YAG. And I think in the US, some of our doctors used a Fraxel laser when there's
As
been
well.
some scarring, correct?
Yes.
Okay, so that's good. Scott's on, our global ambassador director. Hi, Scott. And then now they're posting your number for people. Hi, Dr. Linda, and hi, Dr. Tombris. Hi, Scott. So his question is related to his gums. I have some swelling on my port wine stain side of the inside of my mouth. My gums sometimes swell and are oversized. Do you have any recommendations?
Of course. The best solution to this problem is laser treatment. And in this case, is CO2 laser treatment. But only if we are talking about soft tissue enlargement. If we are talking about bone enlargement as well, then we have to do a reduction of the soft tissue first, and then reduction of the bone with a surgical burr. We try to mold the bone into its right size and to provide a better appearance and function. If you're talking about just gummy enlargement, the solution is CO2 laser. It works very well.
That's great. Thank you for that. A mentor wrote back in and said, thanks, Dr. Linda and Dr. Tombris. Congratulations. See you at the Olympic. We'll see you there.
See you there.
Yep. And okay, so we're waiting for some new questions come in. We have a little bit of a lag. So once again, until the next question comes in, it appears we have 20 people. You can see that up there that are on right now.
Mm-hmm.
Our VBF International All Vascular Birthmarks Conference is October 12th in Irvine, California. You can still register at birthmark.org. And Dr. Tombris will be honored this year as our Physician of the Year. We have free clinic appointments, laser treatments, psychotherapy sessions. It's a great way for you to meet and network with other families. So if you're in the California area or even outside, I mean, we have world-renowned experts in all areas, head to toe, inside and out, that come to our annual conference. So whether it's KTS or Sturge-Weber or cutis mammarata or Koch syndrome, or any of the hemangiomas and port Weinsteins, we have experts in all of those fields coming. And this year we're adding a geneticist and we're adding an expert on overgrowth syndrome. So I'm really looking forward to hearing the new talks that we're bringing in. So
I want to comment that people have to realize, you have to realize that this is not a one-man show. We have to have a multidisciplinary approach in these lesions, and we have to work together to provide the best possible outcome. This is so important for you to realize. The problem is that just because these lesions are very rare and very difficult to deal with, not many people in medicine are willing to participate in the treatment of it. So what we're trying to do is not only to network you to find a solution, we're trying to network the doctors as well to be, let's say, to be able to understand what is the amount of offer they can give, they can provide to people having vascular malformations and vascular lesions. Just because medicine is to help and be able to provide the best possible treatment in all cases, not just the easy cases. These are not easy cases.
and you know what you're talking about right now is the VBFI team, one of our missions,
Yes.
which is to bring the top of the top around the world, to train doctors around the world,
Exactly.
to know what our core group of true experts know. And, you know, we've already been to Russia, India, Israel, Italy, Greece now, next year, China. And my vision has always been for 25 years that every country in the world should have a multidisciplinary treatment center in every state in the U.S. And slowly but surely we're getting there.
Mm-hmm.
So it's better than it was 25 years ago,
Of
but
course.
we still have a ways to go. So we are waiting for your questions. Again, we have Dr. Stavros Tombris from Athens, Greece, from the EVA Clinic, the European Vascular Anomalies Clinic. I see more people are on and logging on, but I'm not seeing any new questions. I just want to make sure I'm not missing any. Kristen joined. Hi, Kristen. So we have Kristen on here. Laura McGinnis says, I have lots of pain with my malformations in my head and face. Is that common?
Well, there are phases during the cycle of the malformation that may be painful. And this is sometimes because due to a phlebolith or due to the alterations of the blood flow within the lesion, then we may have an extent of the vessel walls may get enlarged. And when this happens, you may feel some pain. Down the road, there may be a correction or an alteration of the blood flow in the area, which may relieve the pain. There is no actually treatment for this except for painkillers, unless you have a sclerotherapy or a surgical removal of the lesion. I'm not sure what exactly we're talking about, how diffuse it is or not, but you have to be seen by a specialist and do something in order to avoid these episodes of pain.
So we have a lot of questions coming in now, so that's great. Andrea says that your opinion if tonsils should be moved or left in when a child with a lymphatic malformation has chronic strep, fevers, vomiting, orbits, has happened 7 times since November. So
Again, this is the ENT's decision. He has to evaluate every other aspect, the size of it, the frequency of these episodes. I would say that if it's too frequent, yes, they have to be removed. It's not a very complicated surgery. But again, it's an evaluation of the intervening doctor who's going to see the size of it. We'll take the history and we'll be able to decide. I would be in favor of removing it, but if I had seen the patient, I would have been able to tell you more.
So for any of you that have questions, you can certainly write to Dr. Tombris. His email is posted here, and it's at birthmark.org, and send him photos, and he'd be more than happy to
I will be
give
more
an
than
opinion.
happy to study your case and
Mhm.
be able to provide a more detailed, because
Right.
as you realize, I'm just reading a message. I
Right.
don't see any photos. I don't see the patient. And in medicine, it's very important to be able to perform a clinical evaluation,
Right.
even if it's on photos. So whatever you want to ask me, I have answered through my career thousands of emails. I have a book of emails. So feel free, whatever you need, I will be able to evaluate in detail and get back to you in a more detailed fashion.
Thank you. So Laura says she has a venous malformation in her right temple and her right upper lip. As an infant, they said it was a hemangioma and treated it 18 times with laser. June 26, I'm scheduled for sclerotherapy of the temporal lesion.
Well, that's an option. It can be either a sole treatment or it can be a preparation for surgical removal. It depends if the lesion is resectable, and if it's evaluated as a resectable lesion, then I have removed a lot of vascular malformations from the temporal area, and I did what? I did a preparation with sclerotherapy. My surgical field was dry, and I was able to remove it. So if you want, and if it's possible, I have to see an MRI. If it's possible to be removed, the best solution is to prepare it with sclerotherapy and have it removed. If it's very diffuse, and if there is going to be a big defect, may need a free flap or something, then sclerotherapy is a great option.
Okay, thank you. Leanne writes and wants to know what your thoughts are on sirolimus for lymphatic malformations.
Okay. Sirolimus is a new thing and a very promising one. And it works by reversing the results of mutations that cause the problem when the cells divide and grow with no rules, just because the mutation has happened. Then sirolimus comes into play and corrects this accelerated growth. It's a new drug used for vascular lesions, and the lymphatic component, it has been shown that it's responsive. But the drug is a drug. We really have to evaluate the long-term results of sirolimus. It appears to be very promising, but not that I'm not recommending it. We have to wait for some years to be able to say that this is a great treatment modality. Mm-hmm. I may look not suspicious or reluctant of using it. I would use it, and I have used it to my patients, but we have to be certain that this is not causing any side effects when we put these side effects into the scale, they may become worse than the condition we are trying to treat.
Okay, so we have 10 questions in queue now. So
Okay.
Wajtek wants to know, is there any problems with venous malformations of the left side of the face and epilepsy? My daughter had 2 attacks. She's 8 years old.
Okay, let's see if it's just a venous malformation or a venous malformation associated with a syndrome. Is there any brain involvement? Is it characterized as a venous malformation or a part of another disease which has brain involvement as well? Do we have an MRI? Do we have something that tells us, because it may be coincidental. We have to have more information to be able to answer. Usually and typically, a venous malformation on the, where is it, on the cheek?
Let's see. So she said the left side of the
Left
face.
side of the face will not be associated with
Left
seizures.
side of the face.
Will not be, unless it's a part of a syndrome which has an intracranial involvement.
Good question. Good answer.
Yeah.
Laura wants to know, McGinnis, I have a lot of pain with my malformations in my head and face. Is that common?
Again, I think we've answered it before. Inside the low flow lesions, as venous malformations are, we have phleboliths, and we may have alterations in the blood flow and sudden enlargements or blockade of the flow. So this may cause pain, but this pain should not be constant. If you have constant pain and you're suffering, we have to be able to evaluate what's going on. You have to send us the MRI, you have to send us the history. We will be able to help you. I don't have patients that are in constant pain, but sometimes they do report episodes of feeling uncomfortable, and usually it goes away in a few days with just painkillers. Please send us your MRI and history, and we will be able to tell you more.
She also said that she's scheduled for sclerotherapy on the 26th of
This
this
will
month.
be a very good thing for you.
Yeah, so that'll hopefully, we're praying for you to have good result.
Exactly.
Amy De La Cruz says, I have dry skin and many pimples that pop up on my port wine. Is there anything I can do?
Well, as a surgeon, I'm not really sure what is the best thing to recommend to you. Maybe a dermatologist will be able to help you with this.
Or Dr. Nelson and Dr.
Exactly,
Geronimo.
better than me.
Yeah.
But in our team, we have all the disciplines. We have specialists from different specialties. So we will be able to answer your questions if there is any agent that really can help you with the pimples.
Right. And Dr. Duarte, she's on our website.
Of
She's
course.
our ped derm.
We have
so-
great dermatologists.
And so she does treat a lot of port wine stains with acne that's involved, and you can always ask her.
There is always laser treatment for acne. And,
Right.
Yeah,
True.
pimples. But we have to be very careful because there is an underlying vascular disease.
Mhm.
So on a patient without on a regular skin without a capillary malformation, we have said, yes, we can give an ointment, we can do laser treatment. But in your case, we have to really evaluate what is the best because there is an underlying disease. So we don't want to make the disease worse by using a laser for the pimples that is not suitable for you.
Right. So Amy says, and I know exactly where she's coming from. She's got that skin hypertrophy that she's calling it swollen with her port wine stain. Can she get liposuction? And I know there are some physicians, I know Dr. Levitin does it, when there's like a big port wine that has a lot of fat in the jawline and the neck, he does liposuction, and she might have heard about that. I don't know what your experience is with that.
It will be a procedure with some more bleeding compared to the normal liposuction procedure. If there are doctors willing to do it, yes, it is an option, but you have to discuss it with whoever proposed this to you. In my personal opinion, I would have been, more prone to be able to surgically control the bleeding, meaning doing like an open procedure instead of a liposuction, but this is my personal preference. Doesn't mean this is a rule.
Right, as Dr. Hockman always says, it's the end point that matters.
Yes, because if I go blindly with a cannula and I poke on the tissues and let's say I have bleeding, it would have been for me better to be able to visualize where the bleeding is coming from and stop it.
Now, y'all, Rosenstein Health Fund, I'm not sure if she's coming tomorrow. Her name sounds familiar to me if she's coming to the clinic, but she says that hello to both of us, and she wants to know what the best treatment is for cutis marmorata, and that her 2-year-old was diagnosed with both cutis marmorata and port wine. That happens a lot, because with the port wine, it's very solid, and then that marbling look for the cutis marmorata. The thing is that we tell the moms, you know what part's cutis marmorata because it fades by the
Yes.
time the child's 2 or 3. But with the port wine, it doesn't fade.
It does.
Right.
So we have two conditions maybe at the same time.
Right.
It is true that the cutis marmorata will go away, and actually there are not many treatments recommended for this. It's an aesthetic problem. We can tolerate its existence for some years, but if there is a patch which is which we are able to treat with a laser, we can go ahead and treat this area and improve the aesthetics in the area.
She said that that they've had 3 PDL treatments before the age of 1 in the face, and it resulted in good results.
That's
So,
good.
yeah. I know a lot of the doctors, I know Dr. Geronimus does, and so does Dr. Nelson, but most do not do it. Oh my gosh, Bayun Gu, you need to friend request me. I have not heard from you or seen your name in 15 years. He's one of Milton's patients from, I don't know, probably 1999. I still have a picture of you, Bayun, with your guitar.
That's the year I started.
Yeah, like 1999. It's amazing. Great to see you. Dental implants, safe when the gum is involved. And like I said, Milton did completely lasered his port wine. He had some tissue hypertrophy, which Milton did, and some gum involvement. So,
okay, we were able to place dental implants on maxilla with AVM. So if we were able to place implants on the maxilla with an AVM, gums involved as well, plus the bone, I think in a port wine stain it would be easier. But the problem is you shouldn't go, or a regular dentist shouldn't undertake this case. What I mean is somebody who is experienced in dealing with some bleeding, extra bleeding, must be able to undertake this. It will be easy to control the bleeding. The question is there a bony hypertrophy as well, or just gum hypertrophy? When we cut the gums, it's easy with a cautery or laser to stop the bleeding. So my answer is yes, you can have dental implants as long as you can find someone to undertake
he's
the placement.
and he's in the U.S., so he's in the Midwest. Well, he was in the Midwest. So you can email me. My email's in the string on here. And I can send you to Dr. Darrow to start at least the ball rolling to let you know who in the Midwest might be able to help you.
Again, we can treat the gum hypertrophy first with a CO2 laser.
Right.
And once the disease is settled, we can, in the second stage, put the implants.
Hi, Nicole. She's had an AVM rupture at 11 on her spinal cord back in 2000. And it came back in 2006, and she had an embolization. I've had MRIs and angiograms regularly to watch it, but my walking has gotten much worse in the past few years. Any thoughts?
Any thoughts? This is an evaluation that needs to be done by either a neurosurgeon or orthopedic who is specializing in spine surgery. Actually, these people are very familiar with...
Sorry about that.
That's okay. Are very familiar with the vascular lesions of the spine, and they will be able to help you. Again, we need the history, what happened so far, when the problem started, was it after some intervention or not? Is it getting worse? Is it progressing? We need some details to be able to help you with the problem.
So this next one is so interesting. This is Wojtek again. Remember he said he had hemangioma and we thought it was probably misdiagnosed?
Mhm.
So he's coming to the conference and he's saying his D dimer is high and his level of blood. So is it possible he may have had KHE as a child? I mean,
What is the case exactly?
he was saying that he's coming tomorrow and he was saying he had a hemangioma that was treated with some laser, but he still has activities, and we thought maybe it was a port wine because that was maybe called a hemangioma, but maybe it was a KHE if his D dimers are still high.
Well,
Be interesting to see tomorrow when he
yes, we will
comes.
see you tomorrow. Elevation of D dimers is one element of composite hemangioendothelioma. It's not the only one. We
Right.
need a formal workup, platelet count, other things, the history, and it's not very difficult to have a diagnosis of KAT, and usually we don't even need the biopsy, which may aggravate the lesions. But yes, composite-form hemangioendothelioma is one of the lesions that can elevate the D dimers count, not the only one. So we need to see the rest in order to be able to come to diagnosis.
Yeah. So we have a lot in queues. We got to start getting quick with our answers. So I just said, hello, my son has a VM from his shoulder to his finger and replaced most of his muscle. If we start sirolimus, does the muscle grow again? So will the muscle grow from a chemotherapy agent? Grow back?
Well, in some cases, soft tissue atrophy will not be improved. It will be just the vascular component of the lesion which is going to be controlled. So I'm not really sure what we're talking about, which condition you have, but I have to tell you that the sirolimus will control the vascularity of the lesion, of the area, but it will not, at least directly, affect the growth of the muscles. Maybe if the vascular component is controlled, then with other measures like physiotherapy and giving stimuli to the muscles, we may be able to augment their size and function.
Okay, so we're building up with more and more comments now. We got to get going. So Chris,
That's the goal.
Yeah, Chris is saying, and we talked to Chris before about the fava lesion that she gets very sick with when eating inflammatory food, like, and they can't figure it out. But I don't.
What's inflammatory food?
Well, I don't know what she's talking about. Inflammatory, maybe spicy foods. I don't know.
Yeah.
Maybe she'd have to write. Again, mentor, we'll see you tomorrow about your vascular anomaly. Ask questions about lasers. Laura again is back on and saying sensor VM, temporal lesion feeds down to her face and her lip. If the lesion in the temple is treated and removed, will the lip lesion get smaller? No.
No. It needs two separate procedures or one procedure dealing with two areas of the face. The lip lesion is a relatively small correction. The temporal lesion is not a small correction, if I have the picture of what you have. There will be a defect there, if I can imagine exactly what you have. We can correct this we use some polyethylene implants in order for the contour of the temporal area to be exactly as the opposite side. It's something which is correctable and doable.
Great. So Heather wants to know, and I guess we had this question already, but can there be complications removing tonsils with the port wine stain?
Well, is the tonsillar pillar or the area, the soft palate, involved with
Yeah,
port wine
I don't
stain?
remember. She said if the roof of the mouth, the gums, the tonsils are involved.
If not, it will be a regular tonsillectomy. If it is involved, then the surgeon has to be a little more meticulous in removing the tonsils in a bed of capillary malformation. I wouldn't expect any problems, but we have to make sure that the surgeon is able and experienced enough to correct. Remember, we talked about port wine stain with the gums involvement is the same. It's a little more vascular than the normal tissue, but we go ahead and do it. So if a tissue bed has a capillary malformation, then we are able to remove the tonsils, paying much more attention into controlling the bleeding.
Okay. So we only have 20 minutes left, everybody, but we have 32 questions.
All right.
So we got less than a minute each. So Delia said her son developed glaucoma. His pressure is very good. And she wants to know, will the laser treatments affect the eye, make the eye better?
The skin laser thing?
Yeah, right. And that's what Dr.
No,
Geronimus.
just the skin problem.
Right, Dr. Geronimus and Dr. Nelson have both said that. You're welcome. Well, email me, Bayun. Thank you, Louise. Renata, thank you so much. Nicole wants to know, does a vascular lymphatic malformation play a part in encephalitis? She has lymphatic malformation in the eye and in the face area. I mean, it could. Right?
It could.
Yeah.
If it's a part of a rare syndrome, yes.
Yeah. I mean, what you can do, Nicole, is, email Dr. Wayner, who's our lymphatic malformation expert in the U.S., and we also have Dr. Coletti in Italy, and you can email them both if you have any imaging studies, and they'll give you an opinion to say if it's...
If it's just within the orbit, it shouldn't be causing encephalitis, but we have to see an MRI of the orbit and the brain and see what exactly is happening.
Paige is asking an interesting question because I just heard about this recently. Her son has Sturge-Weber with glaucoma, and he's having this XL Gen stent surgery on June 19th. I've only heard about this stenting with this, so I can't really make an opinion. But you can ask Dr. Comey, our Sturge-Weber syndrome expert, right through our, or Dr. Fay, right through our website. Although this is or Dr. K, K-A-Y-E, who's our glaucoma expert.
Exactly. This is very specialized ophthalmology issue.
So Delia will see us in Greece, so that's good that there's people on here from Greece, and it's saying, oh, I guess we breezed through those. Maybe I thought, because some people are only doing short questions and answers. So we have, oh, that little clock popped up there. I don't need that. Huh? I'm not sure how to get rid of that. Okay, it'll go away on its own. Alrighty. Okay, so once again, this is Dr. Linda from the Vascular Birthmarks Foundation, welcoming you to our June 2019 Facebook Live session, live from Athens, Greece, with the European Vascular Anomalies Medical Director, Dr. Stavros Tombris, who is one of our experts, and our co-director, our co-VBF European Director, along with Dr. Giacomo Coletti of Italy. And Dr. Stavros Tombris is also our 2019 Physician of the Year. So we're very excited that our eye team is assembling right now in Athens tonight, gathering to begin very early Friday morning with our full day of lectures by the top experts that VBF has that are worldwide experts. And then we follow Saturday with our think tank session, the first one that we've ever had. So I'm excited to be able to finally bring a think tank session using these great minds together to gather some important research information. And then we will have our free laser treatments and our free clinic. So all that is coming up. Very exciting stuff. So let me just scroll back through, make sure I didn't miss anything here. Cara says she has a large port wine on the left side that covers her arm and leg. I experience a lot of numbing during the cold. And randomly, is this common?
Numbing.
Yeah, like her leg and arm, it goes numb.
Well,
it goes like she can't feel it.
It may be due to alteration of the sensation of the ending fibers of the nerves. Usually when we have problems on the face, just because the area is smaller, we don't see or we don't hear this complaint. But if it's a large area, it may be possible that the endings, the nerve endings, have a problem as well. So that's why you may be feeling the numbness. What is the treatment? Actually, you should be aiming for the treatment of the condition itself, hoping that the nerve endings will be more functional once the problem is improved or resolved.
And we've had a real strange thing where some of our port wine stain patients talk about their birthmark hurting and getting lighter in the cold, and others darker. So Dr. Mim and I have been talking about that variance. And
well, it's the alteration
the,
in the size of the lumen due to the environmental
right.
influence.
The good question from Laura on any genetic factors with venous malformations. She's got small 3 girls, and our business operations manager, Kristen Herrick Delgado, just came back from the controversies meeting in New York, where she said they stated all vascular anomalies now have been identified with a genetic mutation except for the infantile hemangioma. So I'm assuming they're all talking about that PIK3C,
Yes.
The
There are many.
But
associated with some syndromes.
yes,
We have identified through extensive research many of these. Not everyone, but is the concern if this is inherited or not?
yeah, she wants to know if they should be tested.
Okay. Most of them are just mutations, like a mosaic pattern. It's not inherited. Some of them are inherited. So if you want to go ahead and do a genetic testing, it will be very informative, and I would say, yeah, go ahead and do it, just to make you feel better if the results are negative.
Thank you. Good question from Nancy. So her daughter is 1. She has a port wine on her left cheek. Will she need to be tested for Sturge-Weber or need an MRI? And we know that the V1 area, which is the lower lid and up, is the primary area. The cheek is
one is this, and
yeah.
The other thing is that it should have manifested. I mean, she's 1 year old, right?
Right.
So if you didn't have any problems with the eyes or any neurological signs, I would say no. But it's not. I mean, if you want to be 100% sure, then you may have an MRI of the brain, just to make sure that there is no leptomeningeal involvement, and you have to have a consultation with the ophthalmologist for glaucoma as well.
And Dr. Comey says if you have 2 consecutive ones that are clear, you're pretty much in the clear.
Mm-hmm.
And they break the skin down into the V1, the V2, and the V3. And she doesn't say it's 0 here. She says like 0 to 5%. Then very marginal, and then predominantly like
exactly.
80% in the upper.
When it's in the upper
part. So Elsa says her 15-year-old granddaughter has venous malformation on her lower lip. She had red marks on her cheek, chin, and neck. She always wears face masks to hide these. What is best for her? Seems her lower lip protrudes because of this.
Good question. Okay. So the first, you need to have a sclerotherapy done, and then we have to correct the aesthetic consideration. We have to combine 2 treatment modalities in order to give the best possible aesthetic result. I have to see a picture. Please send a photo to me. We have treated many malformations, VMs, on the lower lip, of the upper lip, and the outcome is very good and promising. So we shouldn't let the patient live with a face mask or a mask covering the problem. There are a lot of things that can be done. So I would say, please send me the picture, send me the photo, and I will be able to tell you what exactly needs to be done, what is the sequence of the steps and treatment protocols that need to be applied in your case.
So Mayondi says her left side of her face, she had a vascular birthmark and looking for laser treatments for that. What type of laser you recommend? But that's presuming it's port wine, right?
Is it a port wine or is it an involuted hemangioma?
Yeah, she's just saying a vascular birthmark.
Head.
Yeah, on her face.
Okay.
Left side of her face.
Okay. If you have a capillary malformation, a port wine stain, the best laser treatment is pulsed dye laser. If you have a residual superficial hemangioma or any type of hemangioma, which is a concern aesthetically after it has involuted, the best thing to do is resurfacing and try to remodel the structure and the quantity of collagen underneath the atrophied skin. I'm giving you both answers because I don't know what exactly you have, but if you want more details, again, you can send a photo and I will give you a more detailed answer.
Great. So we have like less than 10 minutes. So
Mhm.
Tara says she's got a denial letter to see a vascular specialist from Aaron O'Brien, the medical director for Sunshine Health, denied my ability to seek the care I need, stating it's not a medical necessity, which that just drives me insane. There's no doctors in her network. So one of the things we do is we can help you with that, Tara. If you email or even go to my website, and you can find Dr. Delphinian on there. He's really good about writing a free letter for you that you can send on to your insurance company where he says this is a medical necessity. And he's an expert in the quote management of extremity lesions. So you can just write to him. If you don't get through to him, just email me at birthmark.org and I'll find somebody who can help you with that medical necessity. Okay, I want to make sure I haven't missed anything. Thank you. Laser. Yeah. I think I've missed anything. Okay.
I have to comment about how many things have changed since I started this journey. I started it 21 years ago when I was a resident in Boston. And Dr. Martin Mim was establishing his vascular
With
clinic.
me.
Yes,
We established
yes,
it
yes.
together.
That was in January of 1998.
Yep, that was when we had our first clinic.
And I was doing general surgery, the year of general surgery at that time. And Martin Mim asked me to be a member of this clinic. And this is how it started. Since then, I mean, I remember how much we were struggling to identify and explain why some hemangiomas are present at birth and why some of them are not present at birth, but they develop 2-3 weeks after birth. And now we know these are separate entities and they behave differently. And now we have found all these genes that are involved in these rare syndromes associated with vascular lesions. And now we have more treatment modalities, like, for example, propranolol, which is a breakthrough treatment, and it has saved many children from being operated. So this is just a statement to give you hope that even in cases that we don't have a definite answer yet, we will.
So Carney has a good question. Her son is only 3 weeks old.
Mhm.
He's been born with a port wine all over his face, his eyes, his lids, his skull, patches all over his body. I'm still learning about it. How do you treat when it's so extensive? I know I will tell you this, that if Dr. Geronimus can get a baby, and he has, under 4 weeks of age, he'll laser every part that shows.
That's the thing, yes.
You know, the earlier the better.
Earlier, early treatment will be more beneficial than late treatment. Don't wait. Find a specialist. Roy Geronimus is a great laser specialist. Stuart Nelson is a great specialist. So just go ahead and have the whole area treatment.
All right, I'm looking through to see if I forgot anyone. I don't think I have. If your question hasn't been answered, please resubmit it, because I pretty much am trying to read these on the side here, scrolling. Once again, I apologize. I skipped sleep last night flying from New York to Athens. So yeah, we read that about the denial. It says we have 71, so there's some in here that I must be missing, unless they're just thank you notes back. Let's see, I think we have a new one coming in. No. So once again, we have our free Vascular Anomalies conference tomorrow. Friday is for physicians, the talk. Saturday is the free clinic and laser. And
But the families are welcome as well.
Yeah, and the family therapy sessions.
To the physician lecture.
To the physician's lecture, but they have to register, right?
Yeah.
To that, yeah, you have to register. And then in October on the 12th in California, we have our annual all vascular birthmarks conference, which is mainly geared towards the families. We provide breakfast and lunch, free consultation. We have a limited number of free laser treatments because Dr. Nelson can only do the ones he can get in that day. We have psychotherapy sessions with our child life specialists, insurance appeals. So we offer a lot. It's also an opportunity for many of you families for the first time to meet with somebody else that's going through your same struggle. So we really highly recommend that you go to our conference. So you have two choices this year, Athens or
And even in Greece, we have over 100 people, families and patients coming in Athens.
right.
Athens is not, in California, so there is a limited amount of expected patients, but still, we have more than 100 people. I'm not talking about the physicians, I'm talking about families and patients
Right.
that will be accommodated and have a consultation, laser treatment, being able to talk and discuss their condition with one of the experts.
Oh, Leanne just gave us a shout out. She runs Kennedy's Cause, which I've heard about it, which is a really amazing not-for-profit for families affected by lymphatic malformations. I believe we even have them on our website as a support group. They help to raise awareness. So she was just saying thank you to us, and that's very important. So this is Med El Cuadro and Dr. Tombris. This is Rio Centeno from Peru. Congratulations for this broadcast. I want to know, based on your experience, what is the kind of management with aged patients having a mind? Most vascular problems are not pretty responsive in older people. I'm assuming he means laser of a port wine. I don't know.
Well, it depends on the aesthetic or the functional aspect of the condition. Advanced age is not contraindicated to utilize some treatment modalities accordingly. So if you have a condition which is either aesthetically bothering or functionally disturbing, you have to seek treatment. Treatment is provided to any age group. Okay, don't think if you have an advanced stage that you're not a candidate for treatment. You can always seek treatment if you have something which is bothering to you, either aesthetically or functionally.
And as Dr. Weiner says, everyone has a right to look normal.
Exactly.
Every parent has a right to
Exactly.
a normal-looking
We
child.
have treated patients, cancer patients, which were over 80 years old, and we're talking about surgical treatments. So we have treated patients with vascular anomalies, with advanced age, having functional problems or even aesthetic problems. So if there is a treatment available, you have to seek for this available treatment.
Well, it looks like we are down to less than 2 minutes,
Mhm.
and I'm going through here. It looks like I haven't missed any, unless anyone has a question that I haven't answered and you want to pop it back on there, because they come through sometimes really fast. It's hard to see. So I'm scrolling back through them. Oh, wait, there's one I haven't read. What is the best treatment for localized Vino lymphatic vascular malformation and legging cap, sclerotherapy or surgery?
Veno lymphatic, vascular malformation in the leg.
That's KT's probably, form of KT.
Well, sclerotherapy is an option. Surgery can be an option. If we're talking about a debulking procedure, this has to be evaluated. Maybe sirolimus is an option, which the lymphatic part may be responsible. So again, we have to see what exactly the condition is and make the appropriate treatment planning for you. Please send to VBF the photos. The photos will be directed accordingly, and you will have a very, very detailed answer.
So Mayonde Jayasundara on Facebook Live, you cannot share the
I
pictures,
know.
and we can't be seeing them within an hour session when sometimes we had 40 people on at one time. But what we do is offer you a link to Dr. Tombris. All you have to do is put Facebook Live patient in the subject line, Send him some pictures and history and he'll get right back to you.
You have to know that once we get a request for consultation with the pictures, the medical history, all the x-rays, the MRIs, blah, 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 it takes days for us to be able to reach a conclusion. Just because we don't want to give an answer just to give an answer, we have to provide a solution. So we really have to look at every detail that you provide. I know that the live Facebook is not very easy for me or for Linda to be able to evaluate each case. But in a setting that you have sent the information to VBF or to me or one of the VBF experts, we will really take the time, and we are always very happy to do it. This is what we've been doing, I've been doing for the past 20 years. I will continue as much as I can. So please feel free to send us your case, all the details, and I will try to do the best I can to be able to give you an answer.
Well, anyone whose questions haven't been answered, feel free to post them here and they will be tagged to us or forwarded to us. Thank you for our June Facebook Live session. We're now over an hour. And join us next month. I will be announcing where that is because it hasn't been 100% confirmed, but it will be confirmed by Monday. So stay tuned for our next Facebook Live session, which could be either in Europe or back in the US. So thank you again. Take care.
Take care, all of you.